Well, good morning, everyone, and thanks for coming. And I'm really excited to meet all of you and to have an opportunity to share our story about how we went through this process in Benton County as an example, share with you how we've done it, and also to start priming the pump a bit for you all to think about your own work that you're going to be doing here in the next few months. Like Rebecca said, I work with the Benton County Health Services. I'm an epidemiologist, and so that means I like data to inform good decisions. And so that's the whole thing. That's all I do, is just look for the data that's going to help us better understand issues and concerns in our community so that we can then plan effective programs and policies and services to improve the health of everyone in our community. And that's one of the reasons why I really enjoy community health assessments and the improvement planning process, because it's a way for the community to see the data, to see the story and the picture of their own community, and then work together collaboratively to identify solutions that are going to improve health. So what we're going to do today is go over the CHA-CHIP, Community Health Assessment and Improvement Processes, and we'll come back to these issues, and it'd be interesting to hear maybe your responses after we go through this presentation, but just to prime the pump and have you thinking about health issues and concerns in your own community. So we'll go ahead and we'll get started, and so Rebecca's going to help me with the slides. This is the Community Health Assessment and Community Health Improvement Planning process. Really ties well with one of the what I'm learning, trying to quickly learn about the CCOs in our state. One of the fundamental documents that was written in 2010, when there had been a lot of statewide meetings and task forces to really wrestle out, well, what's this CCO, this healthcare transformation, going to look like? And one of the key strategies that was brought forward was this strategy number 2, prevention. So how many of you have seen the Oregon's Action Plan for Health? Has anyone heard of this before? No? Okay, well, this is a document. It's on the Oregon Health Assessment, Oregon Health Authority website, and you can click on CCOs there, and I can also send you guys a PDF if you would like. It's a nice document that kind of explains the spirit of the CCOs and what they were envisioning when they were thinking of bringing a group of community members together as an advisory group and the formation of how we're going to deliver services in Oregon to the OHP population. So strategy 2 is prevention, and I'm going to read it here for you since you may not be able to see it too well in your slides, but it says, strategy 2 in prevention: improve the health, lower costs, and allow smarter allocation of resources. And to achieve this, we must prevent chronic diseases, such as by reducing obesity and tobacco, stimulate innovation and integration among public health systems and communities to increase coordination and reduce duplication, focus resources for drug and alcohol addiction towards prevention and treatment, and improve health equity and population health by improving social, economic, and environmental factors. So all of these things are things that you've mentioned, but this is where the kind of a fundamental belief of the CHA, the Community Health Assessment, and the Community Health Improvement Planning process. It's we want to prevent health issues. We want to understand what our health issues are in our community so that we can prevent them, so that we can prevent anyone ever needing to go to the emergency room or need a specialist. And that's by understanding what are the needs, looking at information, so that we can use our limited resources effectively, which is what they're stating here as well. And the other strategy that, the next one here that we have for is strategy 3, that I believe that was also identified in the Oregon's Action Plan for Health, was health equity. And that basically means that we improve the health of all members of our community, including those who are homeless, those who are low income, those who maybe don't speak English as a native, as their first language, the littlest to the oldest in our community. And that is something that you've all mentioned here today as well. So these are kind of 2 fundamental concepts of the CHA and the CHIP process, and they also tie in well with this Action Plan for Health, which appears to be one of the foundational documents that kind of set the plan for the CCOs here in Oregon. So we'll go on to the next slide. So this is just an overview of what we're going to talk about today. So when you start the CHIP process, you ask a series of questions, and then you look for the data, the information, to answer these questions so that you can improve the health and well-being of families. And so the first one is you ask what? What are the leading health problems, for, in our case, for IHN CCO clients in Lynn, Benton, and Lincoln counties? Okay, so you guys are starting to think about that. You've identified a few things, but we would look more into the data to identify those needs. And then we're going to ask, well, who is most impacted by this health problem, such as the target population? So many of you already mentioned children, families, low income, the homeless. Those are target populations, and we really want to, because each target population is going to have perhaps a slightly different experience. They may have slightly different barriers. And so in order to really plan effective programs and policies, we need to know what those are so we can eliminate barriers to accessing health care. We also need to ask why. Why is this health problem occurring? Why is it that why is it that many people in our community are overweight and obese? Why is it that the homeless are unable to fulfill their prescriptions? Why is it that families are unaware of what is, are not buying and consuming healthy fruits and vegetables? We really want to find out why. And then once we find out these questions, then we get to work. We ask, how can we address this problem? What is it that needs to be done? And most importantly, what are the most effective programs and policies we should implement? And that's looking at a lot of people have been looking at this and studying this and trying to find the most effective use of our funds. If we only have a limited amount of money, how should we spend it? What programs and policies have been evaluated to show that they're making a difference? And so there are some documents which I provided on your agenda. I have more information and resources that you can go to those documents and start to look at what programs and policies have been evaluated and support the health changes that you want to see in your community. So I'm going to go ahead and go into a little bit more depth. So a community health assessment, it describes the state of health of local people, and you have a couple to look at for both Benton and Lynn. When you have lots of reading that you can do for some good examples. It outlines their major health risks, and it identifies ways to improve health outcomes. And this data, it's data on its own is really, it's nice to know, but you really need to put it to work. The whole reason of doing a community health assessment is to increase your understanding so that you can make effective changes in your community. Alone, it's nice. We don't want it sitting on the shelf. We really want it to be usable. And so we use that data to make community decisions. So it's a document, it's a product that many institutions can use. And if if many institutions are working to effect change, then we're more likely to make changes in our community. And so this concept of community and collaboration and working together is something that's very much at the heart of community health assessments and community health improvement planning, and you'll hear me say that over and over again. The CHA data also helps us prioritize which of our health issues are we going to address right now. Because we can only really effectively do maybe one or two things at a time, right? If we think about our own life, it's hard to multitask. We need to focus, use our resources, both time and money, and we prioritize those health issues that we think we can really move the dial on making some changes, and then we say, okay, when we get this health issue done, we're going to go on to the next one. And so it's a way to help us set priorities by looking at who is impacting, what issue is impacting our most people, or which health issue is the most vulnerable being affected by. So you set your criteria on how you're going to prioritize that. And then finally, you use this information to develop the Community Health Improvement Plan, which is the CHIP. And so that's the next slide. Again, the parts of a community health improvement plan that you'll see, the Benton County CHIP will be hopefully ready to go by Friday and posted. I'm going to share some of that with you today. You have Lynn County also as a great example of a CHIP. But some of the key elements of a CHIP is that you identify your strategic issue, you set your goals and objectives, you develop benchmarks, and you prioritize which strategies you will use that are based on the evidence that have been shown to be effective, and then you invite partners, because we can't do this alone. It's a community effort. You invite partners, agencies, other groups. Maybe it's housing, the transportation sector, preschools, education. You invite partners who are also committed to making a change, to be a part of the process. And then these CHIP outcomes are developed based on the CHA findings again through a collaborative process, and I'm going to explain our collaborative process that we used in Benton County to provide guidance to health agencies, its partners, and its stakeholders on improving health of the population within our jurisdiction. Does that make sense to everyone, or is there any questions? Is that nice? I was trying to do a big overview to give you a sense of where we're going. Okay, so we'll move on forward. These are the resources. You know, I keep mentioning that when you select strategies, you want to select strategies that have been shown to be effective. These are the resources, and you have them on your agenda as well. These are just a few resources that can help you understand the research that's been done. People have taken the research and kind of put it all together and written recommendations. There's a document called the Prevention Framework that's coming from the U.S. Surgeon General's office and the Prevention Task Force. It's a nice document that explains what each sector in the community can do. It'll suggest what can the healthcare sector do about this, a particular issue. What can community members do? What can the school district do? So it's really a nice document. There's also the Commission for a Healthier America. That's online. If you put that into your Google search engine, you'll see lots of resources that they've been, health experts across the country have been coming together to tackle issues that are widespread throughout the United States, and they've come up with quite a few documents that are helpful to understanding strategies. The Guide to Community Preventive Services, and then there's also What Works for Health. And that is out of Wisconsin, but they have great tools there that I encourage you when you have time or as we move forward and we get to the CHIP process that you can come back to this and take a look. And these are the resources that I used and our community used when we were developing our CHIP for the Benton County. Okay, we'll go. So I'm going to just give you a little bit of a local example to illustrate this process of a CHA and a CHIP for Benton County. And there's several ways to do this. This is the way that Benton County has chosen, but counties across the country, are doing this, and probably, it'll be hard to find one county doing it this exact same way as another county. So it reflects the style and the personality of the county, but there is a process, fundamental process that you can follow. But there is some art to it, and so I'm going to just share with you a little bit of our experience from Benton County. And you have the CHA document is back there if you want to take it home and look at it, and then the CHIP, like I said, will be coming up shortly. So we'll go ahead and get started. So in Benton County, what we wanted to do is we first wanted to set the scope of our framework of what is health. If we're going to assess health, we need to know what it is and what are the determinants of health. And the framework that we've used is a framework that is being used across the country by the CDC, the U.S. Department for Health and Human Services. I don't know if many of you have heard of Healthy People 2020. It's an online resource, again, that can help you find strategies. But a lot of folks have been looking at the literature for a while now, looking at research on how do we improve health. And there is something called the social determinants of health. It's a framework for understanding how health is produced in a community. And so this definition is coming from the Healthy People 2020, and I'm going to read it to you just in case you can't see it too well. But it says, conditions in the environments in which people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. So it's recognizing that our behavior, perhaps our ability to exercise 5 times a day, our ability to eat fruits and vegetables every day, to go to the doctor when we need to, are greatly shaped by the environment in which we live, but also where we work. Think about where your work conditions are, where you go to school, maybe the church that you go to, that there are social and cultural practices that maybe support health or don't. There may be physical environments that support health or don't. And it's just that recognition that to really understand why a person, the determinants, why a health issue exists, is to understand not only how a person is behaving, what they're doing or not doing, but we also need to understand where these behaviors are taking place, because where they take place will shape, perhaps to some degree, what they can do or cannot do. And we're going to talk more about that. And so that is why you're going to see some of the things that I bring up, and why and because of these social determinants of health, it does broaden the scope, and that's why it's really important to have a community on board, to have transportation department, the folks who run the city buses coming to our meetings to talk about, well, how can we improve transportation options for this neighborhood, because we know this neighborhood is unable to get to the health department that's located downtown. That's why it's important to have the school district there, because children are in school many hours of the day, and that environment may or may not be supporting health, and I think in a lot of cases it is, but perhaps there's little things that we can do, such as increase making sure that recess happens every day and it's not taken away as a punishment, that we allow children to have the recess. So it's things like that's why this is a collaborative effort. Okay. And this is a pyramid that I really like, because it helps us understand that in order to improve health of a community, when we think about understanding health, we need to take a look at several factors. We need to take a look at, do they have access to counseling and education, like what many of you have been saying, making sure that folks have that resource, and that's what we traditionally maybe think about for health and health care, is that looking at having access to those services, which are important in increasing our awareness and making good decisions. We also want to take a look at clinical intervention. How well is that meeting the needs of our community? Is it in the appropriate language? Do people feel comfortable going? Can they get to their care when needed? We look at long-lasting protective interventions. Those things are vaccines, smoking cessation programs, chronic disease management programs, those sorts of things that once a person starts it and they make a behavior change, you hope that it's going to be long-lasting. And that has been shown to be effective as well. But these bottom two, when we think about population, increasing a population's health, research has shown us time and time again that it's when we can change the environment in which people live, when we can put sidewalks in a park across the street and give them access to a grocery store, they're able to practice those behaviors that they've been taught. And that's where, when you're trying to use resources effectively, it's putting money in these bottom two that research right now has shown increased effectiveness. And that supports then the physician and the nurse practitioner, and when they're teaching healthy behaviors, it's supporting them. The families then live in the environment that supports that behavior. And then also it's recognizing that socio and economic factors greatly impact our health. That's because, folks who maybe are unable to read, think about how many things you read every day, especially if you're trying to navigate the healthcare system. And so when we improve education, we see an improvement in health outcomes. When we can improve income status, we see an improvement in health status. Now the thing is here is we can work collaboratively to support those programs that are trying to make these changes. But it also tells us that if we want to mitigate risks and barriers to healthcare, we need to recognize if the majority of our clients are unable to read the prescription and know how to follow the directions, then perhaps we need to do something a little bit differently to help mitigate that barrier, right? Or if our families don't have the income to buy the special foods for our diet, how can we mitigate that barrier for them? What creative things can we do? Can we do referrals to food stamps? Can we do, or can we refer them to other services? So that's a framework that a lot of agencies across the country, a lot of health departments, our state is using this framework, is to understand the issues that impact health. So we'll move right along. So when we did our CHA, and I'm going to show you some of the data, what we did next, we used that framework to identify indicators, and I'm going to show you some of the indicators related to one area. But when we presented the data to our community steering committee, and we presented it a couple of times and allowed people to weigh in, we did what we kind of did today. We asked them to pick their top issue, and we set a prioritization process. And we came up with, we were really wanting only 3 because we wanted something manageable. And this is our first time doing this process, but we have 5. And so these are our big results. So based on the data that we had for Benton County at that time, and this will evolve and change because the more we do this, the more data we're going to get and increase our understanding. But for right now, for the next 5 years, we are committed as a county to work on ensuring that all residents have access to healthy, affordable food, to slow the increase of obesity among all residents, to ensure access to safe, affordable housing for low-income residents and the availability of alternative transportation for all residents, provide access to quality, affordable physical and oral health care for all residents, and improve overall community health. And our big result number 5 is better serve residents who need addiction and mental health behavioral services. So we formed 5 work groups. And we had many people go to all 5. But we had 5 work groups then that took on the task of starting to identify who is most impacted, why, and what is already happening in our community to address these issues, and what could we do next. And that's part of the chip that you're going to see. And this was a very collaborative process. What I'm going to share with you right now is just what we did with number 2, slow the increase of obesity among all residents, to give you a sense of the CHA and the CHIP process. So when we looked at the data in Benton County, the data that we use is at the county level. We're pretty limited in understanding and data, to be honest, at the county level. We can only use a few sources that have been collected nationally or by the state. We don't yet have access to local data that we've collected and that we're using. So we have to, and I'm going to talk about the limitations of the data, and you recognize these limitations too. But in Benton County, this is using the behavioral risk factor surveillance system survey that's done every year in our state. It's a telephone survey. They call adults. It's a random sample. So they have a process of selecting who's going to participate, and they'll call you up on the phone if your number gets drawn, and they'll ask you a set of questions. But they only ask it in English and in Spanish. And they call landline phones. So you can start to see what maybe some of the limitations are. With the way of doing research, if we say we have a random sample, it's a systematic way of selecting who's going to participate based on chance, so that we're actually representative of the community. And so like if I were to sample you all right now, that wouldn't be random, would it? And so it's a convenience sample, and the only thing I can tell you is how many people in this room eat fruits and vegetables. I couldn't use this data to make a statement about Lynn, Benton, and Lincoln, right? But with this way that they do it, when they use a random sample, it's so that they can use smaller sample sizes, save the money, or use their money most effectively because it's pretty expensive, to do and be able to make generalizations. But they are, I was just on a call yesterday, and they are thinking about, this is administered by the CDC, so it's a national survey, so every state does this. But in Oregon, they are thinking about what are some other ways. You know, we've been talking to them about offering it in other languages. The Asian Pacific Islander population is growing in Benton County and across the state, but yet they don't offer it in any other language. And so they are working on it. But we work with what we've got, right? And then we try to do more to fill in the gaps. But it's a pretty good survey, and it helps us get us down the path. And so we find out in Benton County that 35% of our adults are overweight and almost 21% are obese. Although that's slightly better than the state, it's still pretty high, and that's a health issue that we feel like we can work together to address. 8th graders, and the 8th and 11th graders, it's a little bit better of a data collection method. That's the Oregon Healthy Teens Survey, and I believe every schools opt in if they want to do it, but it's offered to every student, and then that data gets analyzed by the state and sent back out to the counties. And for 8th graders in Benton County, about 12% are overweight, which is slightly lower than the state average. And 8th grade obesity is about 7%, which is lower than the state average. And then when we look at 11th graders, overweight 13%, and obesity is 8%, which I don't know if those are statistically different. They may not really, may be pretty close to what the state average is. But what do you think are some issues with this data right here that I'm sharing? One thing is, can it tell me who? Which adults? No. And when you do averages, you lump everybody in, you distort, right? If you have one population who has a higher rate of obesity, I don't see that right now. So that's one thing where we need to fill in the gaps. A gentleman in the back was saying, well, it's perhaps the reason why is because low-income folks, low-income individuals and families don't have the money to buy healthy food. They're buying junk food. And that's a good next question. You want to know why. So we know that obesity is a concern. We may not know exactly who is it the most concern, but we understand that it is a concern. And we can start to look at, this is helping us understand who. This is data that is comparing Benton County to clients who are served at Benton County Health Services. So this is predominantly low-income families, and perhaps that are IHN, CCO clients. And you can see right over here on the very end, the blue is Benton County. And when you look at overweight or obese combined, about 56%, or 1 in every 2 people are either overweight or obese in Benton County. But when you look at the clients who are being served in our clinic, 71%, almost, almost 3 out of every 4 are overweight or obese. So you can see, start to narrow in a little bit on who. So let's go ahead and go to the next slide. So while we know that if you eat fruits and vegetables, you're probably more likely to be thinner, and that we really want to increase folks to eat fruits and vegetables. So we look at the data, and we see that only about a third, 1 out of every 3 youth, 8th graders and 11th graders in our county, are eating their fruits and vegetables. And when we look at the adults, it's about the same, about 1 out of every 3 adults. And that's been pretty consistent over the past several years that we've been doing that risk behavior survey. So when we look at what we know, physical activity is also a determinant of overweight and obesity. And again, when we look at our 8th graders and our 11th graders, we're not doing too well. A quarter to a third, 1 out of every 4 or 1 out of every 3 youth are meeting the physical activity guidelines. And for adults, it's around 60% of adults are meeting the activity guidelines. But again, that's an average, and we don't know how other groups are doing. So that's a little bit about the behaviors, right? That's the first thing, and trying to understand why individuals may be overweight or obese. We looked at those 2 main behaviors, eating fruits and vegetables and physical activity. But now we need to understand, well, the environment in which this is happening. What is the environment like for our families in Benton County? And so we're going to look at understanding the context. So we're going to move on. This is all Benton County, just as an example. In Benton County, when we look at the county as a whole, We're predominantly white, but we do have a pretty high Asian Pacific Islander population, about 5.5%, which is higher than the state average. And we also have a growing Hispanic Latino community. And it's interesting, it's about 6%. And again, those are folks who answered the phone on the census. This is U.S. Census data, so it's for those folks who answered their phone and who could speak the language. And I know that they do Spanish and English, and I need to find out if they do it in other languages. But when we look, this is the county as a whole, but if you go to the next slide, you're going to see the youth in our community. These are all the elementary schools in our community. When you look at, if you were to look on this far side right here along the edge, total minority, our youth are more diverse in regards to race, ethnicity than our county as a whole. At one school at Garfield, 59% of the children are non-white. At Lincoln Elementary, 44%. And when you look in the rural areas as well, in Monroe, almost 20% of the children are of race or ethnic minority, predominantly Hispanic Latino, and in Philomath, 11%. And so with that diversity comes a different range of different abilities in understanding our system, cultural practices and beliefs, and our language is another thing as well. So the next slide shows how many people in our community in Benton County speak a language other than English. About 11% speak a language other than English, or in addition to English, perhaps. And about 2,500 of those are what we would consider linguistically isolated. And that means that nobody in their home over the age of 5 speaks English very well. And that's a pretty sizable group for our community. 34% of those are Spanish language speakers. 30% are Asian and Pacific Island languages, and that's a variety of languages. And then 18% of other languages, and 16% are Indo-European language speakers. And so with that comes limited access to information and services. That's self-report. That's a self-report that anyone over the age of 5. So you decide what's your ability to speak English. Do you speak it well, very well, not very well at all, or none at all? It's that type of question. If it's self-report, someone may actually speak better or understand better than what they perceive. But the thing is that if that's their perception, they may be nervous, and that may make it hard to communicate, especially on something related to health. I know my husband, he's a native Spanish speaker, and he has a PhD, and you would never know when he speaks English. You know, he's been able to read, you know, he's gone to through college and written a lot of papers and done a lot of presentations, and you may never know that he speaks Spanish natively. But when he goes to the doctor, because it's a health issue, he prefers to speak in Spanish, and that's just because it's so personal. So that's the other thing too, is our ability to communicate and explain what's happening to us in a native language sometimes is makes us more comfortable, and we're able to understand things a little better. So we'll go on to the next slide. This is a map that you cannot see, but I'm going to tell you what it is. And so this is looking at, this is Corvallis right here. And can you barely tell there's an orange change in color? It's an orange right here. This is along 9th Street in Corvallis. If you're familiar with Corvallis, where all of the fast food restaurants and all the new stores, the new Walmart store just went in. This is saying that 12% of those people who do not speak English very well, they all live in this neighborhood, up to Circle, if you're familiar. It's along Highland, 9th Street, and Circle. It is also telling us that over here in Philomath, I think that's 5.3% of individuals who do not speak English very well live in Philomath. And we see 5% live in South Corvallis. So it's helping us visually map where these households were. And so you can start to get targeted. You know where maybe you need to target your intervention and outreach. Okay, so we'll go on to the next slide. We also looked at income, and this is per capita, and this is for all the workers in our community. And we look at, if we put all individuals who identify as white in a category, and we averaged out their income, we can see that a white wage earner earns on average $27,000 in Benton County. So this is just averages, right? We're spreading out the distribution. When we look at African Americans in Benton County who work, on average they earn $17,000, $10,000 less than a white wage earner. And a Latino earns the lowest on average, $15,000. So that's just showing you that there are differences that among wage earners, and due to a variety of reasons, but this can impact health, and it's just important to notice how different are they or how alike are they. We also know that poverty is also a big determinant of health, because it not only determines what you can and cannot buy in terms of health, in terms of food, but maybe the neighborhood in which you live in or the house that you live in, which can all impact our health. And in Benton County, 1 out of 5 residents live below the federal poverty threshold, which was $17,000 for one person in 2012. This is predominantly adults, youth under the age of 18, Asian, Hispanic, Latino, and those with a less than a high school education. But we know that these thresholds in some ways are arbitrary. They don't truly represent the needs of people. When economists look at how much money does a family really need to meet all of their basic needs, such as health care, groceries, rent, health insurance, many economists say they need at least 185% of federal poverty, which for a family of 4, I believe, is like $45,000. You need at least that much money to meet your basic needs. And in Benton County, 1 out of 3 residents are living below that threshold. And so it's just important to recognize that. Okay, we'll go on to the next thing. We're almost there. This is just showing you again the differences. This is looking at the percentage of children under 18 living in households earning less than that 100% of federal poverty. When we look at Benton County, it's about 21%, which is about the same as the state of Oregon in the U.S. But when we look at those clients going to Benton Health Services, this number, which I can't read either, is, I think it's 43.97. 43.97. So almost half of the clients at Benton County Health Services are children. Almost half of the children there are in families that are making less than what they need to meet their basic needs. Okay. So, food insecurity. You have a handout there on food insecurity. That's the ability to access nutritious foods at all times for your family. And we have a growing population. This is happening across the country, but in Benton County, about 15% of all residents in Benton County live in a household that was struggling to provide food consistently that was culturally appropriate and that was nutritionally appropriate. And many of these families are earning money too high to qualify for any of the programs that we have in place to support families when they need extra help getting food, such as the WIC, Mother, Infant, and Child Program, or the SNAP, food stamps. 64% of those who were food insecure in Benton County made too much money to get any sort of assistance. And when we look at children, which we know that it's important when children are growing and going to school to have nutrition, 22% of our children in Benton County lived in a home that at some time didn't have enough money to provide food, and about half of those children are in homes that make too much money to qualify for WIC or SNAP. So, that's also, I looked at the free and reduced school meals, and we have quite a few families in our community that qualify, but it differs by school. And so when we look at this data, it's always important to look at a variety, not just the average, but look at the schools. We have Garfield, Lincoln, Wilson, and Mountain View, where over half the children are on free and reduced lunch. And we also know that homelessness is a growing issue among families in our community. And in Benton County as a whole, about 3% of students, public school students, in 2010, 2011 were homeless at some point. But again, that masks the differences among the different schools. And we have, and in Monroe, almost 9%, and in Alsea, 8% of students at one point in the last year didn't have a place to stay. And then, I think I'm getting close to the end of this section, limited access to healthy food. One thing that we did, in addition to data that we can get at the county level from the state, we did our own survey in Benton County, and we tried to get it out to as many people as we could. We had it in paper, we had it online on the computer, we had it in Spanish and in English, and we should have had it in other languages as well after we but we didn't, and that's something that we're going to improve on. But we got as many people as we could to answer the survey, and when we looked at the demographics of who responded, it's like most surveys. It's usually those who are older, who have a college degree, and who are white and female. But we wanted to make sure that this data was showing a picture that was more representative of the population. So what we did is we analyzed it by education in this instance, and we had asked a question: what is the one factor in the environment in which you live that impacts your ability to be healthy? The options were bicycle and walking infrastructure, such as bike paths and sidewalks and bike lanes, the number or density of liquor stores, the number or density of tobacco outlets, the number or density of fast food restaurants, and the access to recreational facilities such as parks and trails. And when we looked at those who have less than a high school degree or a high school degree, they said fast food. When we looked at that map, we did the same thing for education, and they're living, the folks with a lower education are living in an area where there's predominantly fast food restaurants. And it's also interesting to note that, have you guys heard of the county health rankings? Benton County gets a lot of attention sometimes that we're either number 1 or number 2. But we do have lots of areas to improve on, and one area that they recommend is we have among the highest density of fast food restaurants in the state, in our county. And so it's you want to use more than one data source, right, to check your data, and so to tell the story. And so this made sense to me when those families with lower education were saying fast food restaurants are a concern. So one more slide is transportation. We also looked at transportation, and in Benton County we do pretty well on biking and walking. About 8 and 10% of individuals say that they walk or bike to work, but we still drive a lot, and so we're pretty car dependent. For families then who don't have a car or have access to a reliable transportation, that can be a problem. And we could improve on our public transit. So now we start to look at the environment in which families may be living in, and maybe we can start to understand why we don't have as many individuals eating healthy fruits and vegetables. If food insecurity is as high as it is, we have a number of families on free and reduced lunch. We have families who are food insecure but don't have access to the support systems that are in place. We start to understand those behaviors a little more. So now we took this information. We had the work group met, and we did a SWOT analysis where they talk about their strengths, weaknesses, opportunities, and threats. So we took that data. Like I said, we had 5 areas, right? And I'm showing you obesity. But all of these interact, which you can, on this slide here, it's a set of 5 circles overlapping. Because obesity, as you see, touches on food security. Obesity also touches on housing and transportation, access to health care, and mental and behavior health. Individuals who have mental health issues have diabetes at a higher rate, and that can be and looking at obesity. So all of these things, it's hard to tease them out, but we tried to pull them out. But we did have work group members who went to all of these, and because they are so interrelated. We also then identified, as the steering committee identified 4 themes that they wanted us to focus on when we got together in our work groups to identify strategies. They wanted to make sure that we thought about prevention. What can we do to prevent obesity? Thinking about how can coordination and navigation like what you guys were mentioning, think about how we can help families use the services that we have in place already and better coordinate that. Thinking about access and affordability, and also considering equity, which means thinking of all populations. So this is the next slide, is showing you our goals. We had 3 goals for our CHIP. We have decrease the prevalence of overweight and obesity, encourage physical activity lifestyles, and reduce the consumption of soda and other sugar-sweetened beverages. So those are our goals, and we then selected our objectives that we're going to, how will we know if we reach our goals? So these are just an example from each of the goals. I chose one. We actually have a couple under each goal. And this is using the data that we have available from the county right now. And these are our goals. If we met these are our objectives to let us know if we met our goals. Decrease the proportion of adults ages 18 and older in Benton County who are overweight from 35% to 31% by 2018. The next one was determine and increase the proportion of children ages 3 to 5 who engage daily in at least 60 minutes of physical activity. There isn't currently a surveillance system out there that collects this data, but yet we know preschool is a very vulnerable stage that we want to get a handle on. And so we've set as one of our objectives an objective to do an assessment. And so we're going to try to measure that and then improve on that measure. And then the last one, decrease the proportion of 11th graders who report drinking 7 or more sodas or sugar-sweetened beverages per week from 14 to 17% or 12% by 2018. We're going to try to decrease that. And so the next one then is showing you, so we set those objectives. These are the strategies that were identified by the work group based on our current resources, what we thought we could probably do in the next 3 to 5 years, and also what is informed by those best practices. What does the evidence show us that if we did these things, we're actually going to perhaps reach our goal? This is a list, and we still need to narrow this even more and come up with a work plan on how to do these things. The work group is going to come back. We have this list for them to choose, but the work group is going to select 3 or 4 strategies that they can commit to and then develop a work plan and a strategy to do that. So this is even more detailed, is going to keep coming. Details will keep coming, and we're going to come back together in the next couple of months. But the 4 strategies that we have up here are assessment. We want to use mapping techniques to describe the walkable routes and transportation options to schools and parks throughout Benton County. We want to increase, with outreach and education, we want to increase availability of culturally and linguistically appropriate obesity prevention programs and planning strategies. Through community collaboration and mobilization, we want to identify opportunities for collaborative and coordinated planning to maximize obesity prevention initiatives across diverse sectors. So that means we want to get in the same room the school district, transportation, school meals, the farmers market, community development, and say, what can we do? How can we work together when we make plans to reduce the barriers for families to walk and bike and eat healthy food? And we also then, in participation in policy and planning, we want to promote participation of public health in the planning process at the local government level. So I've mentioned before that this is a collaboration. It's not just the health department alone. It's going to take many, many partners. And these are the potential partners. Public agencies, such as our elected officials, our mayor, our county commissioners, local and regional transportation agencies, school districts, parks and rec, senior centers, and then community partners such as parent-teacher associations, neighborhood groups, OSU Extension, nonprofits, community benefit organizations. Medical providers need to be a part of this too, and grocers and farmers markets and multicultural groups. So the next steps, which I mentioned, we're going to reconvene our obesity work group, and this is where it's an opportunity for you all here in Benton County. If you're an IHN-CCO advisory member, we would love for you to come and be on a work group. If it's not obesity, we have 4 others, because we need your voice. We need a broad representation of stakeholders on these work groups to help us even define it even more on who's going to be targeted and who's going to do the work. But we need voices of the Healthy Aging Coalition. We're inviting them to come, maternal and child health nurses, parents and teachers at schools, and then you all and others who represent different segments of our population. We will then prioritize the goals and choose which of those 3 goals we're going to work on for the first year or so, and then how are we going to do it. And then we will develop the work plan for the next 5 years that will identify the target population. So is it children? Is it the elderly? Is it adolescents? Where is this going to happen? Is it in the clinic? Is it in the parks? We're going to develop even more specific objectives and then decide who is going to be the lead. So that's the CHIP for us. I do want to respond. We had 2 questions during the break, and I thought they were important questions and to share with the group. One was asked, well, what was your time frame for all this work that you did in Benton County, and when do you do this again? Very good questions. I came on board in August of 2013 in this role. I had been previously doing childhood obesity prevention at the health department, so that's why we're focusing on obesity today. I came on board in August, and I started pulling together a lot of that data that had been, as you could see, we didn't really collect a lot of new data. We did the survey. It had already happened. It happened about a year before I came on board. But we analyzed that. We pulled the data that was secondary, and we really just tried to find the data that had already been done and put it together in one document. A lot of surveys and assessments happen out there, but they don't usually come together and to tell a complete story. So that was what I started to do in August of 2013, and we presented it at the end of October. So I worked pretty intently with others at the health department to pull it together, and what is that, August, September, October, 3 months. We presented it at the end of October, and then the work group started right away at the beginning of November, and we pulled it all together in April. So it was a very tight timeline. But this is a process. So we know that this is not a perfect CHA and CHIP. We're still working on it, and that's the beauty of being a process. We just keep identifying our needs. We've identified more data that we need to make decisions, and so that's been incorporated into our CHIP, and we're going to keep working on this. We're going to keep looking at data along the way, but it's 5 years that we'll do this big process of bringing everyone back again, because it's not just the data, it's the interpretation of the data and making meaning of it and telling the complete story. And so that comes with community members coming and looking and responding from their perspective, from the agency's perspectives. All of that is going to happen every 5 years. But we will keep looking at this and moving forward. Our work groups will keep walking down that path of trying to preventing obesity, and we'll use data along the way. Some we already have, but some we know that we need to collect. But it's a process. So I just wanted to highlight that. And the other question was, maybe a population to keep in mind, which may resonate for many here who have family members or friends who are dual eligible. Another population group that's been mentioned in addition to children and seniors and homeless, low income, are those who are dual eligible for both Medicaid and Medicare and their ability to find providers who will accept that insurance, but also maybe then they're triple eligible if they also have long-term care. So just another thing to keep in mind. So what I wanted to do right now, I'm going to show, because I was showing you Benton County data because that's what I had time to pull together. But Rebecca and I have been talking about this and wanting to make this as useful for you all, not only to give you an overview of the process and an example, one way that one county did it, but to have you start thinking about, well, what data do you need to help you in making this CHIP or in coordinating your CHIP with other CHIPs that are in your county already, because Benton County has a CHIP. Lynn County has a CHIP, and we're working hard in Lincoln County, and we're going to have the CHA done soon, and then the CHIP can start right away. How can you integrate with those efforts and make sure that your group, your population, is at the table and their voices are heard? Okay, and so that's kind of what we're going to focus right now. And so just a reminder of the CHOT process. What you ask, what are the leading health problems? Who is most impacted? Why is this problem occurring? What are those determinants that influence that health issue? And then the CHIP is the how. How can we address this problem? And what are the most effective programs and policies we should implement? And so what works, how we should do this for IHN, CCO clients, may look different for another population group. And it's important to make sure that those voices are at the table to make sure that their needs are being met. So I just wanted to show you, the next slide here is when I looked at the time that I had to pull some data for this presentation, I asked DHS for numbers on OHP eligible and enrolled for the 3 counties. And this graph here will show you the age distribution, right? We are trying to understand population needs based on a variety of indicators, whether that's education level or age or race ethnicity. So this is by age, and I'll tell you what this says. It says that 34% of those in the 3 counties combined, and this is reflective for each county as a whole, is each county individually as well. 34% of those who are enrolled or eligible for OHP are ages 6 to 19. That's the largest proportion, the biggest proportion for OHP, IHN, or OHP clients enrolled or eligible. The next biggest group is ages 20 to 40, and that's about 22% of those who are eligible or enrolled are ages 20 to 40. But if you looked at going back down towards children, we have 3% are less than 1, 16% are ages 1 to 5, and that 34% are ages 6 to 19. If you combine those to look at and just had it be youth under the age of 19, almost, or if not half of those half of the OHP clients are under the age of 19. 21% are ages 20 to 40, 18% are ages 40 to 66, and 6% are greater than 67. Just to give you a little bit of background. And the next slide is showing you the 3 counties here, because there are differences. This is looking at overweight and obesity. So when we look at Benton, Lincoln, Lynn, and Oregon, the state of Oregon, the blue is overweight. The percentage of the adults, this is adults, that answered that behavior risk factor survey by phone. The proportion of adults in the 3 counties who are overweight, which is blue, or red is obese. You can see that Lynn has a statistically higher number of obese. The proportion of obese adults is higher than the state average. Almost 30% of adults in Lynn County are obese. And so the next slide, just to show you a little bit of data for the 3 counties. This is looking at consumption of fruits and vegetables for the 8th graders, which are blue, 11th graders, which are red, and the adults, which are green, that greenish yellow color. And so you can see there are patterns that are the same, but there are some differences as well. So I just wanted to share with you a little bit of information. And then the next slide is tobacco use. For the 3 counties and compared to Oregon, the blue is how many adults indicate that they smoke cigarettes, and the red is how many quit attempts per county. And you can see there's a lot of quit attempts happening in Lincoln and Lynn. 50% of the adults who were smoking said that they had tried to quit in the last, I believe it's last 30 days. But we do see higher than average smoking rates by adults in Lincoln and Lynn, 27% and 21%. And we see lower than average in Benton, which is 11%. So we're going to go on, but this was just to help get you thinking, because what I would like for you to do right now is I'm going to pass out the cards again, and you're just going to pair up with someone for about 5-10 minutes to talk about this data. Does this type of data, either the Benton County data that I showed you if you're in Benton County, or a little bit of the Lincoln and Lynn data, does this type of data provide enough information for you to understand the health concerns of IHN and CCO clients? And if so, you can say why. But if not, why? And what else do you want to know? And so this is the point where I'm going to come back. You're going to write down what questions you have. What else do you want to know? And I'm going to try to find the data for you to answer your questions. So think about what else do you want to know about IHN CCO clients in your county. And I'm going to come back in a month or two and present and just do a 45-minute presentation and provide you the information. So I'm going to start that digging of the data for you to get you on your way. That is one thing that we are doing. Like I mentioned before, this is a process, and we're keeping moving forward. And there are some ways that we can address gaps such as these. And what we tried to do in Benton County over the past few years, we have done some targeted forums where we brought people together. Perhaps I've done work on nutrition. I've wanted to know about the nutritional needs for Latina mothers in Lynn and Benton. So I interviewed them, and I've done focus groups with them. And that helps fill in some of the gaps in our understanding. And I didn't present that information here, but that is the type of data that we can then use when we are planning programs and policies. So there's things like that that you can do if sometimes the numbers that get collected don't tell the complete story, and we need to dig a little deeper. And that's when we can do conversations or focus groups where you can invite people in to talk about their experiences. That's one way that you can fill in the gaps right away, but I'll look up some more answers for you too. Well, thank you, and I'm going to collect those, and I'm going to use those to. I'll type up all the questions so you can see what everybody had asked, and then I'll do my best to answer as many as I can. For the next steps here, Rebecca and I have been thinking about next steps. That's on the next slide here as we move to the end of our time together. I'm going to find the answers to the questions. And then over the next few months, as I understand it, you guys are going to continue to work on this, to set priorities, and to dig even. And I encourage you, this will be the first step as much as we can. I mean, you could always get more data, but at some point we have to just move forward with what we've got. We feel like we have enough sense of we know where we're going, and we're going to keep collecting it as we go. But just to encourage you to always try to look to see who is impacted. Try to understand who is impacted by the health issue, which you guys have brought up today. What are the underlying causes of these health issues, and how can we prevent this health issue, and what does best practice tell us, and which community partners need to be involved. And then that information will help you with your development of your goals and objectives and benchmarks. So I think that's all that I really wanted to share with you. You have my contact information. You have my email there, and you can always send me an email or get in touch with me through Rebecca. But I'll be planning to come back. But I hope this was helpful. I hope it provided an idea of what a CHA chip process looks like, and helping you move forward in your work, because you guys have some really important and great work to do that I'm really excited that I can help you, even if it's just a small way.